Right now, I need you to breathe in and breathe out. Deep breaths. Now hold your breath for as long as you can. Keep holding it. Now imagine what it would feel like to not be able to breathe, not by choice but because the lung has been damaged so badly. This is one of the most awful ways to die. Therefore, we have to take care of our lungs very well. Today we're going to be discussing how to prevent and reverse lung diseases. And we're going to be taking excerpts from the chapter 2 of the same book as last time, How Not to Die, Discover the Foods Scientifically Proven to Prevent and Reverse Disease, written by Micheal Greger. Hello and welcome to Pharm Glo's Clinic, your number one stop for everything on health and wellness. Make sure to subscribe to this channel and don't forget to click on the notification bell. Also, please give this video a big thumbs up, and if you ever have any concerns, questions, or opinions about the video, don't be shy. Just leave a comment down below. Now let's get into the video. The Forum of International Respiratory Societies, FIRS, released frightening data showing that most people are unaware of lung disease, which kills more people than any other disease worldwide and claims the lives of 4 million people annually. Despite the high prevalence of lung disease, a study conducted by the market research firm YouGov across 4 continents showed that people are much more worried about cancer, heart disease, and stroke than they are of lung disease. The lack of concern is even more striking when you consider that research indicates that the mortality rate brought on by COPD, or chronic obstructive pulmonary disease, has almost doubled in the last 30 years, while the death rate of the majority of other major diseases has been declining over the same period of time. The public survey indicates that people misjudge the severity of lung disease and lack management skills. Despite the fact that straightforward lung tests like spirometry help doctors detect COPD, asthma, and other lung disorders early on when therapy is most successful, 57% of respondents said they had never had their lungs tested. The first and probably the most important thing to mention is stop smoking. About 220,000 cases of lung cancer are identified each year in the US, and it claims more lives each year than the following 3 cancers combined: colon, breast, and pancreas. Nearly 400,000 Americans are constantly affected by lung cancer, which casts a gloomy shadow over their lives. Contrary to heart disease, which has not yet completely been recognized as being caused by an artery-clogging diet, smoking is widely considered to be the leading cause of lung cancer. Up to 90% of all lung cancer fatalities are caused by tobacco use, according to the American Lung Association. Compared to non-smokers, men who smoke are 23 times more likely to develop lung cancer, and women are 13 times more likely to develop it. Additionally, smokers are not only endangering their own lives, as secondhand smoke has also been linked to hundreds of annual fatalities. If non-smokers are exposed to cigarette smoke on a regular basis, their risk of lung cancer increases by 20 to 30%. The link between smoking and lung cancer has long been known, but for a very long time, it was concealed by influential interest groups, such as the relationship between certain foods and other significant causes of death is suppressed today. For instance, the nation's largest cigarette producer, Philip Morris, started the infamous White Coat Project in the 1980s. The corporation employed doctors to publish ghost-written studies that sought to disprove the associations between secondhand smoke and lung illness. If you're still a smoker in spite of all these data and recommendations, the best advice to give you right now is to quit smoking. Now, please. Quitting brings about instant benefits. The American Cancer Society claims that your heart rate and blood pressure begin to drop within 20 minutes after you stop smoking. Your breathing and blood circulation both get better within a few weeks. The sweeper cells that assist in clearing the lungs of mucus and decreasing the risk of infection begin to proliferate again within a few months. And your smoking-related risk of coronary heart disease will be reduced to 50% within a year of quitting, compared to the risk of current smokers. Next thing to do is to prevent or manage lung disease, and that is to load up on broccoli and other veggies. Scientists frequently investigate persistent smokers to evaluate the effectiveness of dietary changes to reduce DNA damage. Researchers gathered a sample of longtime smokers and instructed them to eat 25 times more broccoli than the typical American consumes daily, that is, 1 stalk. After 10 days, the broccoli-eating smokers were found to have suffered 41% fewer DNA mutations in their bloodstream when compared to the broccoli-avoiding smokers. Now, Did this happen only because the detoxifying activity of the enzymes in their livers was increased by the broccoli, which helped them eliminate toxins before they even reached the smoking-related cells? Well, no. The genetic material from the broccoli eaters exhibited considerably less damage even after being taken from the patient's bodies, and exposed it to an unknown DNA-damaging chemical, indicating that eating vegetables like broccoli can increase your resilience at a subcellular level. Don't assume that this means that eating a stalk of broccoli will totally counteract the cancer-causing consequences of smoking a pack of Marlboro Reds. Not at all. However, veggies like broccoli, cabbage, and cauliflower may help stop more harm while you're attempting to quit. You still have to quit for the veggies to work and help your body heal itself completely. The concentrations of a particular protein called NRF2, which protects the lung against inflammation-related injury, have been found to be deficient in the lungs of people with more severe COPD, according to research by Dr. Shyam Biswal and colleagues from the Johns Hopkins School of Medicine in Baltimore. However, broccoli contains a compound that helps stabilize NRF2 levels in the lung. Some tissue samples from the lungs of smokers and ex-smokers with or without COPD were examined by Biswal and colleagues. COPD lung tissue displayed a substantial decrease in the activity and concentration of NRF2-dependent anti-inflammatory antioxidants as compared to healthy lung tissue. Sulforaphane, a component of broccoli, has proved successful in reversing the antioxidant imbalance in COPD lung tissue in several tests. Use turmeric. Turmeric, an Indian spice that gives curry powder its distinctive gold color, may also lessen some of the DNA damage brought on by smoking. More than 1,000 distinct substances have been examined by the National Cancer Institute since 1987 for their chemopreventive cancer-preventing capability. Only a few dozen have advanced to clinical trials, and curcumin, the turmeric's vivid yellow pigment, is one of the most promising. Researchers have looked into how curcumin affects the ability of different carcinogens to mutate DNA, and they discovered that curcumin was in fact an excellent anti-mutagenic against a number of common cancer-causing agents. Due to its effectiveness in pulmonary conditions with abnormal inflammatory responses, the anti-inflammatory property of curcumin found in turmeric is crucial in improving the functioning of the lungs and helps in conditions like asthma, chronic obstructive pulmonary disease, pulmonary fibrosis, and acute lung injury. The asthma-related inflammation of the airways and tightness in the chest could both be alleviated by the curcumin molecule. Eat fish and walnuts. Patients with chronic lung disorders like chronic obstructive pulmonary disease benefit from the omega-3 fatty acids that are derived from fish. Additionally, it possesses anti-inflammatory qualities that help individuals with COPD reduce lung inflammation. In addition to fatty acids, fish oil shields the lungs from infections caused by the bacterium Haemophilus influenza. The walnut comes to the aid of vegetarians who refuse to consume the omega-3 fatty acids from fish. Walnuts contain a high concentration of omega-3 fatty acids, while, like fish oil, can aid COPD sufferers by reducing lung inflammation. Asthma and other respiratory conditions can be bought with as little as one handful every day. In conclusion, even if you're one of the millions of Americans with lung disease already, giving up smoking and making dietary changes can help. Starting a better lifestyle and diet can be done at any time. Although the human body has amazing healing abilities, you still need to support your body. You might just be able to boost your respiratory defenses and breathe easier by including foods that fight cancer and eating a lot of antioxidant-rich fruits and vegetables. What do you think about the video? Let us know down in the comments section. And that's it for today. Be sure to subscribe to the channel and click on the notification bell. Smash that like button and we will see you in the next video.